Delusions of grandeur, also known as grandiose delusions, are a type of delusion or false belief. People who experience delusions of grandeur may believe that they are famous or godlike, that they are very rich, wealthy, powerful and talented, that they have some special gift, that they're world famous, and that they are talking to celebrities. And a common one is often that they believe that they're going to marry a very rich and famous person, whether that is royalty or a pop star. Some of the delusions often have religious or supernatural or spiritual themes, even if the person themselves is an atheist. Delusions of grandeur are often part of bipolar 1 manic depression. Delusions of grandeur can serve as a psychological compensation for a life perceived of non-achievement, and they provide a sense of purpose, of self-esteem and special identity, which compensate for a lack of any achievement in real life. Though these false beliefs are symptoms of an underlying mental health condition like bipolar disorder or schizophrenia. These delusions offer a fantasy-based reality that sustains the individual's self-worth, especially when actual achievements are lacking, and they're best addressed through professional treatment, which can include medication and psychotherapy. Delusions of grandeur do serve certain psychological functions. Firstly, they can compensate for a lack of achievement in real life. Grandiose delusions can provide a psychological boost, compensating for feelings of failure or inadequacy by creating an alternative reality where the person is famous, powerful, or incredibly talented, or have some special mission or purpose in life. They can also help to sustain self-esteem. These beliefs help to sustain or increase a person's self-esteem and provide a sense of purpose and self-identity that may be absent in their actual life. They can give some kind of meaning and purpose, although it is only temporary. The delusions can give a sense of meaning to their experience and provide a feeling of belonging or a feeling of some kind of special purpose or role, giving some importance to their life. Delusions of grandeur are not a condition on their own, but they are a symptom of other mental health disorders, including bipolar disorder, schizophrenia, delusional disorder, and sometimes substance use disorders. Treatment approaches include medication. Antipsychotic medications can be crucial in stabilising mood and reducing the intensity of psychotic symptoms, helping the delusions to fade over time. Therapy can also be employed. Talking therapies can help individuals to understand the meaning of their beliefs and explore the psychological mechanisms that maintain them. A fractional modification of the delusion rather than a total removal may be more effective if the delusion is central to the individual's self-esteem. Building trust and providing emotional support without confirming or denying the delusion can make the person feel safer and more open to treatment. It's also important that when the person is well, that they engage in some meaningful activities, that they find something that will give their life meaning without needing to resort to delusions, that they maybe try to develop a skill, do something creative, maybe attend some evening classes or day classes, attain some qualifications, particularly if they are long-term unemployed due to their mental health issues. Doing some other kind of meaningful activity is important, where paid employment is not an option. Voluntary work, study, joining societies, getting involved in political or spiritual activities, work for the community, volunteering, etc. can all give meaning to life, which may help a person to remain stable and not drift off into delusions of grandeur. Delusions of grandeur and other psychotic symptoms, commonly regarded as marks of madness, can also be construed as protective responses to a psychological crisis, viewed in the context of a person's life experiences. Recent research has shown that delusions develop in people who have experienced adverse circumstances and overwhelmingly negative emotions in their lives and face despair or suicidal thoughts. The development of delusions and hallucinations can sometimes be a response to a sustained experience of despair and powerlessness. Psychotherapy, then, can help with overcoming and dealing with the effects of trauma and with developing coping strategies. However, if there are ongoing, threatening and extremely stressful circumstances, the individual will need to be removed from the extreme stresses before therapy can help. Delusions of grandeur are very different from having high self-esteem, and they are persistent false beliefs in one's exceptional importance, abilities or identity, often disconnected from reality and resistant to any contradiction. They are common in conditions like schizophrenia, bipolar disorder and narcissistic personality disorder, and they can disrupt relationships, judgment and daily functioning. And when challenged, the individual can often become very aggressive and hostile. Delusions of grandeur or grandiose delusions include a person having irrational beliefs about their importance or abilities. Typical features include claims of possessing hidden genius or supernatural powers, a conviction of having a unique relationship with famous individuals, and a certainty of extraordinary talents without any proof. Often they will be very irrational and contradict themselves whilst maintaining the conviction that they have special powers and are highly intelligent. These beliefs can be very isolating, as friends or family may struggle to challenge them and are often met with hostility, such that the person alienates all their friends and family. When such distortions become ingrained, they can severely limit one's ability to interpret reality. People experiencing these symptoms will often avoid professional help due to a perceived lack of need, because they believe that they are all-powerful and that it is everyone else who needs the help rather than them. A grandiose type of delusion can manifest in various ways, including believing one is destined for global fame or financial gain, super riches, becoming a billionaire, without there being any evidence and often without there being any means of attaining any sort of money. Some individuals view themselves as chosen to lead a significant movement or being a messiah of some sort, a world leader, or hold privileged insight unavailable to others, sometimes through some kind of intuition and communication with God, angels, or other forces, possibly aliens. Typical examples include asserting that they are a long-lost royal heir, or that their artistic creations are going to achieve fame, or sometimes when they don't even have any particular talent, they believe that they will achieve fame without even knowing how, but they are just going to become famous, perhaps being a Hollywood movie star when they've never actually done any acting in their life, or becoming a famous DJ or rock star when they have no musical ability. They'll often insist on special treatment because of presumed extraordinary status. They'll make exaggerated claims of influence over political or social events, or believe that they have created world peace or solved all the world's problems, or are going to solve the world's problems. They will often feel uniquely knowledgeable about scientific or spiritual truths. And as I said earlier, a strong sense of self-worth differs significantly from a false belief that defies any logical explanation. A healthy level of confidence aligns with actual achievements and recognises room for improvement, while delusional thinking rejects any contradictory proof. In a high self-esteem scenario, individuals typically remain open to feedback and reality checks. But a person with a delusional conviction about their power or status will cling on to this belief despite overwhelming evidence to the contrary, and will become very angry and aggressive and hostile to anyone who contradicts them or tries to point out the reality of their situation. Recognising these distinctions is essential for offering supportive guidance and, if necessary, professional evaluation. Certain behaviours signal potential risk factors for delusions of grandeur. These indicators may appear gradually, making it crucial to remain vigilant. A pattern of exaggerating achievements or talents far beyond plausibility, continuous pursuit of validation for perceived special abilities, irrationality or hostility when others question their grand claims. Individuals exhibiting such tendencies will often alienate friends, family and colleagues who doubt their stories. And if these delusions intensify or persist, the person may become very isolated, and guidance from a mental health professional and treatment is required. A pronounced inflated sense of self emerges in thinking patterns tied to delusions of grandeur. Emotionally, individuals may fluctuate between euphoria when validating their imagined feats and anger if anyone challenges them. They will tend to dismiss any logical contradictions, won't take any notice of facts that are presented to them. They will avoid any evidence-based discussions, and they will display heightened anxiety when forced to confront reality, and will avoid confronting reality at all costs. These reactions will strain personal relationships and fuel defensive communication. Over time, family and friends may feel powerless to redirect the person's perspective, underscoring the importance of timely intervention. When delusions become entrenched, they can significantly disrupt daily life and social connections. In some cases, these patterns may intersect with dynamics like weaponized incompetence, which can further complicate communication and support. At work, for instance, refusing constructive feedback can hamper performance and teamwork. In personal relationships, friends and loved ones might grow frustrated or hurt by unrealistic claims. Certain factors may increase susceptibility to delusions of grandeur. These include biological predispositions, such as genetic components of brain chemistry imbalances, psychological stresses such as trauma, loss or overwhelming life events, neurodevelopmental factors such as irregularities in cognitive processing or emotional regulation, and environmental influences such as cultural norms or upbringing reinforcing exaggerated self-perceptions. Multiple mental health conditions can present with symptoms of exaggerated self-worth. These conditions often exhibit overlapping features, making it challenging to isolate delusions of grandeur as a sole symptom. Psychiatric disorders like psychotic and mood-related illnesses frequently include such beliefs. Additionally, certain personality disorders can manifest as persistent patterns of inflated self-image. Though each diagnosis has special criteria and treatment approaches, the presence of grandiose delusions usually indicates a need for thorough assessment by a qualified medical health professional. Managing delusions of grandeur typically involves tailored therapies and, when warranted, medication. A strong therapeutic alliance and a patient-centred plan can enhance motivation for change. Collaborating with a mental health team can offer specialised interventions aimed at preserving dignity while addressing the distortions that fuel these beliefs. Many clients benefit from psychotherapeutic interventions that encourage honest self-reflection, reality testing, and emotional regulation. These treatments are designed to reduce the harmful impact of delusional thinking on relationships, work, and self-esteem. Through consistent sessions, individuals can explore the origins of their beliefs and develop insight into their thought processes. The chosen therapeutic modality often depends on the individual's overall condition, willingness to engage, and the presence of any co-occurring psychiatric symptoms. Unfortunately, People with delusions of grandeur are often very reluctant to seek any help because they do not believe that they have a problem. Rather, they believe that they are the answer to the world's problems. Cognitive behavioural therapy addresses unhelpful thought patterns by challenging and reframing them. But it is often necessary for the person to be stabilised with medication before any kind of therapy will take effect. Insight-oriented and supportive therapies can help in combination with pharmacological treatments. Medication can help stabilise brain chemistry, reducing the intensity of false beliefs and boosting receptivity to therapy. Antipsychotic medications are commonly used when grandiose delusions stem from psychotic conditions. By targeting neurotransmitters like dopamine, these drugs can help diminish severe distortions in perception. Regular follow-up is essential to balance symptom control with potential side effects, such as fatigue or changes in metabolism. It's also important to note that medication does need to be reviewed regularly because changes in brain chemistry can mean that a person is no longer responding well to the medication, and the medication may need to be changed. So a person can still have psychotic symptoms when taking their medication regularly. Another complication is that when a person begins having delusions of grandeur, they often believe that they do not require their medication anymore, and this complicates things further. For individuals whose delusions coincide with manic or depressive phases, mood stabilisers may lessen extreme emotional swings that fuel irrational thinking. Antidepressants, when indicated, can help address underlying depressive symptoms without exacerbating grandiosity. Tailoring medication to each person's needs prevents over-medication and promotes long-term adherence. Support from friends and loved ones can significantly impact outcomes. And family members and friends need to be involved in education about delusions, medication, and coping strategies. When relatives maintain open communication without reinforcing grandiose claims, it provides a stable environment for recovering. Encouraging understanding and respectful boundary setting can all contribute to a more consistent improvement in day-to-day functioning. This coordinated approach reduces isolation, offering a team-like atmosphere that fosters resilience. Individuals diagnosed with delusional disorders often require ongoing strategies to prevent relapse. A stable routine, self-monitoring, and mental health support can reduce the likelihood of future episodes. Consider the following tips. Maintaining regular therapy sessions to help develop insight, not just having therapy whilst undergoing treatment for a severe psychotic episode or delusional episode, but the therapy should be continued regularly in between any such episodes so that the person develops some level of insight and learns to recognise the signs before they get further into a delusional episode. Track early warning signs such as changes in sleep or mood. Foster communication with a trusted network of friends or mentors and develop stress reduction techniques such as using mindfulness and meditation or journaling. Such measures can help reinforce healthy thought patterns, making it easier to recognise when grandiose thinking resurfaces. But it is also important to develop some kind of meaning in life and to take part in meaningful activities which will give the person a heightened sense of self-esteem without the need to go into further delusions of grandeur. Delusional thinking goes well beyond mere confidence. Individuals with extreme self-belief typically remain grounded in reality and accept constructive criticism or contradictory evidence. By contrast, someone who clings to delusion of grandeur resists any counterproof, even if it's overwhelming. Their self-view is anchored in an unshakable conviction of extraordinary status or abilities. High self-esteem might encourage realistic goal setting and personal growth, whereas delusional certainty often disrupts practical judgment and close relationships, generating conflict or isolation over time. So it is important to distinguish between delusions of grandeur and high self-esteem. And a person who is prone to suffering from episodes of delusional thinking with delusions of grandeur will need help to develop their own self-esteem. Low levels of self-esteem have been implicated as both a cause and a consequence of severe mental disorders. Research has shown that low self-esteem appears to increase the risk of psychiatric disorders such as depression, eating disorders, and substance abuse. In psychotic disorders, low self-esteem has been implicated in both the development of delusions and the maintenance of psychotic symptoms. Support to improve self-esteem, deal with stress, and develop meaningful activities and meaning to life are therefore all important in preventing relapse into delusional thinking and psychotic symptoms, and particularly delusions of grandeur.